Today's episode of the Stallside Podcast was brought to you by Rood and Riddle Veterinary Pharmacy.
Hey, Bart, how you going this week?
I'm good. I'm having an awesome day. How about you?
I'm good. You know, I'm really excited about today's show. We've got some very talented people from Rood and Riddle on the show.
Me too. And I think this will highlight the level of competency that exists behind the scenes, because we've kidnapped a few of our technicians to come in with us and spend some time with us today and spend some time with them today.
Absolutely. We have Lexie and Monique from our Anesthesia service, and we have Stephanie from our surgery service. And these technicians are really the engine room. They're the people that get everything ready, get the horse anesthetized, get the horse stable through anesthesia, get the horse woken up. They're the people that make sure the horse is coming up from the barn, is healthy for surgery, is positioned in the right way, and that the surgeon has everything they want when they need it laid out in a logical order. So while the surgeon or the medicine person may be the face of the case, These are the people behind the scenes. These are the shoulders which we stand on that make us better than we deserve to be.
Highly skilled, incredibly important people to this practice.
Absolutely.
We wouldn't be where we're at without them.
No, absolutely. They are the engine room of Rood and Riddle. So on Stallside this week, we're talking to members of our anesthesia and surgery technician service, and you'll get an insight into just how organised this clinic is and how many people it takes to make it function. Our illustrious anesthesia and surgery technicians. Monique, welcome to Stallside. Tell us a little bit about yourself.
Thanks, Dr. Morresey. So I'm one of our licensed anesthesia technicians here at Rood and Riddle. I've been doing anesthesia since 2020 here, and I was I guess you call them nurse or an assistant vet tech in the barns here and at other locations for about 6 to 7 years.
Where are you from?
So originally, I'm a little bit from everywhere. My dad was military. We moved all around, but I guess you can probably say Florida would be where, I suppose most of my family is located. So that could be where I'm from.
Okay. Yeah, fair enough. Stephanie, slightly different role. Tell us about yourself.
A little bit different. My name is Stephanie Welsh. I am one of the senior surgery techs at Rood and Riddle, and I was born in Philadelphia, but I claim to be from Florida, so... I graduated from college and immediately came to Kentucky because this is what I wanted to do, and I wanted to be in the racing industry in a medical way. So this was pretty much my goal.
So Lexie, tell us a little bit about yourself.
Hi, my name is Lexie Conrow. I'm one of the anesthesia technicians here at Rood and Riddle. I'm originally from Reno, Nevada. I started at an equine practice there when I was going through college in 2008, and then decided to go to tech school, did my externship here at Rood and Riddle, stayed on for about 2 years, and then I moved back to Reno, and then I have been back here now for just about this will be my 4th season back, so very exciting.
Yeah, no, it's great, and I know with what I do, it's always good to see you guys when I actually take something up there that needs some surgery, but also I don't think a lot of people realise, even listening to this call, that there are so many people involved when a horse comes in for surgery, right? It's from the people that are getting the horse ready to getting the horse set up on the surgery table for the surgeon. But as Larry Bramblage said, one of the greatest advances in equine surgery has been anesthesia, because it allows us to anesthetize the horse safely, have it under a surgical plane of anesthesia throughout the procedure so he can do his best work, and then wake the horse up safely so it can go ahead and take the first stages towards healing. So for those of you on the anesthesia team, tell us a little bit about your day and how you get your mindset to approach your patients.
Well, I can go ahead and start with that.
Yeah.
Of course, it starts in the morning. You could get your drugs together, make sure that everything is in line, that you can take, any kind of case that comes through the doors. Some of them are scheduled. Sometimes it's, an emergency, a colic or a dystocia, or, a baby who's maybe lame. And then as soon as we see our patient, we always evaluate it visually. We're going to take a look at the whole horse, make sure that there's nothing obviously, wrong other than what they're there for. With the help of our surgery technicians, which are just, we work together super closely, vital to the team. Our main role is to make sure that the horse and the team are going to be safe. The animal is anesthetized properly, not going to wake up on the table, but also the horse is going to be safe. So, they can recover they can recover well, have enough analgesia, so pain relief, that they can get up without any, difficulty, any ataxia, which, meaning wobbling or anything like that.
So, Stephanie, Monique has touched a little bit on the close way that the anaesthesia and the surgery techs work together. How does your day go? Say there is a surgery case coming along. Where do you start in this process, and how do you follow that case through till the point where it can be handed off to recovery?
So the surgery techs, our main job would be to bring the horse up from the barns, depending on which barn they're in, and that will also depend on what kind of case it is. We'll bring the horse up to the surgery building. We will make sure they are ready for anesthesia while rinsing their mouth out and making sure their pre-ops are given. And after that, they're going to be walked into the induction stall, and the surgery tech team is going to assist the anesthesia team in getting that horse on the ground. So we're going to make sure that we're handling it appropriately depending on what kind of case it is. And we're also going to help get that horse on the ground, which we will call dropping. And we will put hands on the horse as they're going down and make sure they are glided down to the floor safely and that everybody is in a safe place.
Yeah, because there's a lot of things you got to think about when anesthetizing a horse that are different than, like I had anesthesia not too long ago, and they go, just put this on, count backwards from 10. That's not exactly the way it goes with horses. So there's some risks involved.
Yes.
Are there any of those cases that or get your blood pressure up a little bit more than others?
Oh, absolutely.
Oh, yes,
Yeah,
for sure.
Just like with people, different horses take different doses of drugs. Some of them get on the table and they sleep super well. We don't have to worry about them the whole time. They're great. Others just need a whole lot more, dosage and bumps and trying to keep them, safely asleep and on the table.
Yeah.
And make sure they stay that way.
It's kind of a big deal if a horse wakes up in the middle of surgery.
It would be, yeah. But the most surprising thing I just heard?
What's that?
That Bart can count backwards from 10.
I've never made it past 8, though.
Yeah, seriously.
So we don't know.
We don't know how far you can go. Yeah.
It's over. It's all over.
But a lot of this is backstage, and that's what I think a lot of people don't realise, is that, the surgeon may be the face of this procedure, but a lot of what you're talking about is backstage. And, often I'm in a position when I'm presenting you guys with a patient, and I just sit back and I watch just how finely tuned and organised this ballet is. Everybody's in the right place at the right time. You mentioned safety, and I don't think we can emphasise too much that horses can be large, dangerous animals. And everybody is in position, everybody is looking out for each other. I mean, this is an example of how people can actually work together for the greater good. And two people can be the equivalent of 3 or 4 people because you guys are so well coordinated and you know each other so well. Lexie, your anesthesia skills are tapped a lot for a slightly different category of horses, the little ones. So you get called in a lot late at night for the neonatal anesthesia. So tell me about that and what's special about the neonates. How did you end up doing that? Is it something you really like doing, or is this just something that played to your skill base?
It's definitely something that requires a little bit different skill set. We spend a lot of years training, from when we start tech school all the way up until obviously we're on our own and credentialed and all that. And then here at Rood and Riddle, we spend several years before you ever take on starting to do the neonates. But yeah, they are an extra challenge. One of the things that I love about them is that we get to work again as a team with not just our regular team, our anesthesia and our surgery tech, but we also get to coordinate with the internal medicine departments. That's the main thing, because you guys will take those patients in usually and then decide that they need to go to surgery. So that requires a lot of coordination between our two departments. Understanding the history of those patients is really vital, especially when they're going into a surgical procedure. Was the full up in nursing? Has it been up at all? Is it just recumbent? What is the procedure that's going on? Those horses are a lot, sicker usually. The neonates, they tend to crash and burn, as we all know. They also, bounce back really quick, which is wonderful, and what's what makes those cases so rewarding. So,
yeah, no, you're exactly right. The foals are very fragile. You can go from 30 minutes to something running around the stall to on the floor of the stall, and then 30 minutes are up again. Yeah. I mean, they're very resilient, but you have to create an environment where they can be resilient. So, Stephanie, you also are involved in some of the more specialised surgeries that are done around here, and one in particular is the cervical stabilisation surgery. So tell me, What's special about those cases? How do they have to be handled? It's a little bit different because I know you're always there in the morning and you just have the smile on your face when you have one of those cases. So what is your thing about these basket surgeries?
Well, for one, they are one of my favorite cases to do for multiple reasons. But as far as specializing as the surgery tech on the case, they are very particular in the way that we have to place the horse on the table. It has to be extremely straight. It has to be exactly in the middle of the table. And we want to make sure that once we move that horse from the recovery or induction stall to the table and we move it once over to where the overhead surgery lights are, that we are not going to move that horse again because placement is so critical in those cases. And once that is done, we need to make sure everything is in place, from the padding to the ropes that we're using to hold those legs back to all of the instrumentation on the table that is in the correct order for them to use. And our surgeon that does them, Dr. Woody, he is quite particular about all of those things and wants to make sure they are done the same way every time. So having one or two people being able to specialize in that type of case makes it go a lot quicker and a lot smoother than having to teach a new person every time the case comes around what is important.
And I think you bring out a good point there in that this is not like a generic thing, right? Just because you're a surgery tech doesn't mean you do the same thing all the time, because that's what I've noticed with those stabilization surgeries. There's a certain crew that has actually gravitated together and actually manages those cases very closely. But then that's the nature of that, right? Because that's a very, very complicated surgery. What's one of the other really precise, complicated surgeries that you find yourself involved in?
That would be the arthrodesis.
Right.
So that could be a case where it is involving arthritis of the joint, and it's a salvage procedure for maybe a aged broodmare that they're trying to give a better life to at the end of her years, or it could be a breakdown on the racetrack that we're trying to make sure has a somewhat of a productive life afterwards. Usually those are fillies and mares, but there are also some cases where some clients will choose to save their gelding or stallion for future use for something else.
Well, it's just the emotional attachment as well, right? I mean, horses aren't just a business for everybody. They're actually part of their life. Stephanie, you've talked a lot about sort of the specialised things you do, but Monique, you have a rather interesting background before you came to see us. And so could you talk a little bit about how you started in a more general role and what actually drew you to sort of, become very sort of specialised and talented in anaesthesia? What made you go down that path?
Thank you for saying so.
I only speak the truth.
So I actually started in small animal. I'm going to speak that as a bad word, but so I started in small animal, did that very briefly, procured my first job over at Virginia Tech Equine Hospital, and it was love at first sight. I loved the nursing, the patient care, you give the medications, you're there for, a few days every week, and you get to see the patient improve every day. Very satisfying. And I did that for, like I said, 6-7 years at a couple different hospitals. I did at one point do ambulatory work with Dr. Latcher, who we both know, down in Spring Hill Equine in Florida. And that was, again, lovely. She's a wonderful woman. Florida is not for me. It is far too warm down there. And then I came up to Rood and Riddle for this job, for nursing in the barns. But I'm also a lifelong learner. So after I learned sort of everything about the role, I was looking for something a bit more mentally challenging. And that's when this anesthesia position opened up. And it's, if the first time was love at first sight, then this was, I guess, love at second sight. I don't think I would do anything else. It's fun. It's changing every day. It's a different case every day. It's just, it's wonderful. It's challenging,
Yeah, and you're right. They're not all the same, right? Because I don't always present you guys, and none of us do present you guys with the perfect patient a lot of the time, because they don't send us to horses because they're healthy.
Correct.
They send us to horses because they're sick. And sometimes our job is to, as quickly as possible, give you the best chance to actually do the best work that you can possibly do.
But wait a minute. So, but being an ambulatory assistant had to be the pinnacle of your career. So what's mentally challenging was dealing with different doctors, I'm sure, not that the work's any different.
But get your grubby hands off our anesthesia technician.
I want to know, how in the world did we get all through? What's going on over at the hospital? Who's running that right now? I'm a little bit like, it's a little bit like flying in a plane and all of a sudden the captain and the co-pilots come back and talk to you. I don't know who's running the ship over there.
There's this great thing called autopilot.
We have a large and talented team that we can,
that
are efficient.
All right. As long as there's somebody else over there.
And that's a good point, and emphasize the team. Now, Monique, you talked about your sort of like very broad background, but Lexie, you're actually quite involved in actually a program where people come here and get an educational experience. Could you talk a little bit about that, and also the process of becoming licensed? Because all of you are licensed, and that actually has enabled you with your extra education to do the amazing things that you do. So Lexie, the floor is yours. Tell us about that process.
Sure. So I guess I should kind of say that there are two different types of technicians, and the terminology is different depending on which state you're in. Here in Kentucky, we do call them credentialed or licensed technicians. And they are people who have gone through extra training, extra school. There's an accreditation process that goes through the American Veterinary Medical Association, the AVMA. So they have to have completed a program through there, and then they take a national board exam, and then they can be credentialed with the state or go and be licensed through the state of Kentucky. So anyone that's not credentialed is technically considered a veterinary assistant under the state, but we use that term kind of broadly, the term technician broadly. The uncredentialed technicians are so wonderful at their job. They obviously play a vital role in our practice, but it is kind of that when you've gone that extra step to get that credentialing process, you just get to do more essentially within the practice. You have that extra set of skills.
So talk about that just a little bit. What is the advantage of getting the credentials?
Yeah, so I mean, as Monique kind of said, if you're a lifelong learner, if you want that extra education, you want specific training with anatomy and physiology, it's essentially, I like to describe going through a technician program it's very similar to a human nursing program. We come out with the same kind of skill set through a formal training. So that's kind of the main issue. A lot of places will actually offer a higher pay scale. Obviously, that's a nice benefit for a lot of people. And then there are things, depending on the state that you're in, where you could have a set of skills that are only allowed for the credentialed people to do versus uncredentialed. And there is actually, as a part of the schooling process for the credentialed techs, most programs do require some sort of externship or a preceptorship where they have to go into a hospital. It can be a small animal, large animal, anything like that, to get some extra skills, real world experience, if you will. So Rood and Riddle does have a program like that for technician students. I'm the coordinator of that program. So we get students from all over the country. This year, I actually have a student from Puerto Rico coming as well, who come here for several weeks to observe. Sometimes they can get some hands-on skills, depending on the circumstances. To really kind of broaden their education. I love it when I see students that are trying to, they have some like personal horse experience, but maybe have never been in a clinic setting. And I love to see those students come through and they're like, oh my gosh, this is so cool. I didn't realize that an equine hospital would provide this kind of extra education. So
you're a good example of that, right? You came all the way from Reno?
Yep. Yeah.
So why pick clear across the country in Lexington, Kentucky, rather than sticking around? Because surely there were some programs closer to you.
Yeah, so I went to a technician program in Reno, but my story with Rood and Riddle goes back to when I was 10 years old. Actually, I came to Lexington I was a horse girl, so I came to Lexington on just a trip, and we took a tour of Rood and Riddle, and I was like, I think that's what I want to do. So, and I want to work there. And so when I decided, obviously I went through school and I was maybe pre-vet, maybe technician, decided to go technician. Mm-hmm. And then I immediately said, I want to do my externship at Rood and Riddle. And I made it happen. And then Stephanie was my mentor back then.
Oh, yeah.
Yep. And we've known each other a long time. And so I got hired on. And so that's kind of how I ended up here at Rood and Riddle.
What year did you come here, Stephanie? Tell me again.
I was here February 2008.
February 2008, so quite a while.
Yeah,
16
yeah.
years.
And that's the thing. I mean, building a team like this and people with this amount of skill takes time. And it's great that you guys have actually stayed with us as the practice has grown, but also as we've expanded out the services we can offer, because it's totally dependent on what you guys do to actually help us do that. And, Rood and Riddle does have a little bit of feels it has a mandate for education, right? We're all trying to improve things, and we have a lot of visitors at all levels come to see us, and we really appreciate you taking charge of the technician part of it, because we can't do the jobs we do without highly skilled people like you guys, because we can't do everything. And you guys present us with patients which we can do the best possible things that we can do with, right? And,
and Stephanie talked about it, how important that team is. And when you've got somebody in place that you are comfortable with, we've all done things where we're very efficient at what we're doing. Change the personnel that's helping you, and it's totally, it's a little bit like a running back with their a different line. It's just you can muddle your way through it, but it doesn't go quite as good if you don't have the people you have trained.
Yeah, it's like Brady and Edelman or something like that. He just knows where to throw the ball, and the guys there just catching it over the shoulder, touchdown. It's the same sort of thing, and you got no idea how relieving it is to me. Like, I've got this foal that I need surgery on, and you got no idea how relieving it is to me and how much better I feel when I rock that horse up to you, and then I can just see you guys just take it over. And all of a sudden I'm thinking, no matter what the outcome is, it's going to be okay, right? It's going to get the best possible chance to have the best possible outcome, because I've got the best people on the job. And you guys, your commitment shows, right? I mean, this is not something that everybody can do. It's not something that comes easily. I mean, you're all working really hard at this, and, we really appreciate how hard you work at what you do.
Yeah, and that's a little bit why we wanted to have this show, was just to show how much talent and dedication there is behind the scenes that's not always seen right up front when people walk their horse off the trailer, or you guys are behind the scenes, but it functions so well, and there's so much skill that people don't see.
Yeah, and hopefully there's somebody out there that's actually listening to this podcast and sort of saying, hey, you've all got a story that's actually brought you here, and someone would say, hey, there's that very thing, I want to come to Rood and Riddle and have a look. And then maybe one person can say, when, Bart and I are about 400 years old, still doing the podcast, that, hey, we heard the podcast that day, and that's why we came to Rood and Riddle.
Well, like Lexie said, she had the option of going to veterinary school or being a technician. She chose the technician route because going through all that schooling is not for everybody. There's reasons that people, and it's a great alternative.
Yeah, and we need people to do these things, because we can't do our job without you guys. I've said that about 5 times, but we cannot do what we do without you guys, and that's something I'd emphasize to the audience, is that, when you come in here, there's an ecosystem, right? And everybody has their place. It's extremely well coordinated, and it's just great to have good people commit to a team and actually think about a bigger goal than themselves.
100%.
And you guys are the personification of that.
So Monique, what's the? I'm gonna ask all of you guys this. What's the most rewarding part of your job for you? What do you go home and think about? What's the best? What gets you up in the morning?
I mean, well, that one may need to be. I'm kind of trying to think, is it, like favorite surgery, or let me see. I can't, I'm just.
It's just all of it. There's so many choices. You're sort of like me when I go to the Ghirardelli store. So there's just so many choices. I'm paralyzed, right?
You go to Crank and Boom, I'll take a scoop of everything.
Yeah, there you go. And then I know I've got the right one.
Yeah. No, I mean, I love everything about, everything that I do on anesthesia. I love there's the rewarding part of, getting a horse that walks in, let's say, an elbow fracture, can't put any weight on the limb. He's, hobbling in, and by the end of that surgery, they've plated it. We've given him some pain relief. He gets up well in recovery and walks well back to his stall, in clearly way less pain, than when he came in. And that's extremely rewarding. What you guys were mentioning about, teams working together, I would say my favorite case is a dystocia, and that's just because you can see the teamwork best in a dystocia case better than almost any other case. This mare walks in, she's clearly in, at some sort of state of distress, having her baby, unable to do so, walks in the door, and from the second she walks in the door, we converge on her like, ants on a piece of candy. Everyone has a very particular role. Everyone knows their role. They're not getting in anyone else's way. Everything is just so incredibly efficient. Of course, adrenaline filled too, which is, maybe that's the real part of it, is maybe I'm an adrenaline junkie. But, that mare, comes in, we very quickly get her down, we get baby out, hopefully, baby's alive, hopefully, and that's just, it's wonderful to be able to be a part of that.
Okay, excellent. Stephanie?
So I have a few different avenues that I go down. I am a huge racing fan and have been since Ali Sheba. So part of what gets me up every day is knowing that being a part of fixing those horses and seeing them get back to where they came from is something that's very special.
Yeah, no, we've got in the conference room over here, we've got the pictures of all the Derby winners and the number of horses that have been touched by Rood and Riddle, either before they won the Derby or after is incredible. And it's that for me too. That's one of my favorite things, is being associated with that greatness, even though, there's lots of people involved. Just being a small part of some of those great horses' careers is special.
Definitely. So I guess one of my most rewarding kind of cases are, again, the neonates, like what Dr. Morresey was talking about earlier. I love when we get a recumbent foal in, can bring it up to surgery, fix, the ruptured bladder and, get it feeling better and back up to the stall. But from a personal standpoint, kind of the thing that gets me up and going in the morning and the most rewarding part of my job is actually the teaching aspect of it. I love, obviously I've spoken a lot about the students and all of that and that process. But we also actually do a lot of teaching for our intern veterinarians too on anesthesia. Mm-hmm. We are the ones that kind of get them up to speed on our protocols here and kind of help them in their journey as little baby veterinarians. Mm-hmm. And that's really rewarding for me to be able to kind of be a small contributing factor to them becoming the amazing doctors that they're going to be. And kind of seeing, their growth and just seeing them learn as well is just really rewarding for me.
That's a really good point. And, we should have said it, is that people don't realize just how much impact you have on the interns as they're starting their career. Because I remember when I was starting off, who taught me to do a cat spay, right? Right? That's basically the way it was. And none of the other veterinarians in the practice had any interest. They said, what have we done employing him? And then the nurses took pity on me. And so I actually got to do all those sorts of things. So you're exactly right. Your impact on the veterinary profession is actually huge, because we hear it time and time again where interns will see them at a conference and they'll be thanking us for the education that they had here. And they sort of said, there was this horse that came in and I had to anesthetize it and I got through this, right? And they all start off thinking they'll never be able to handle it. And they leave here, they can drop any horse anytime, and as good a chance as anybody in the world of getting that horse up again. And that's because of what you have taught them. So absolutely. And when it comes to the surgery thing as well, how do you get yourself organized? You mentioned about the particular nature of laying out a table and laying out the patient. You've got to really commit to being that precise. And surgeons being what they are very particular. So more power to you for dealing with all of them, because I don't think I could, right? And that's just a fact. But that's the way they like their things their way, right? And we need people like you that actually can cope with that. But what keeps you coming to work?
All of those things. We talked about some of the so great. I liked people. It's fun interacting with people on the farms, people that I work with every day. It's the human relations. I get just enough. I like having animal patients, the horse patients, but also having those relationships with people is great.
No, that's important. Yeah, this is a good place to be.
Yeah, and we play some practical jokes and have a lot of fun, and all in good order.
All in good order, yes.
Yes. How about you?
Why do I come to work each day? Well, I get to have the old bonus of doing stall-side podcasts with Bart Barber.
Sweet.
Yeah, I know. Call me Pinocchio. No, I think it's like jumping out of a plane. Some people jump out of a plane, perfectly good plane, they parachute to the ground and they land and they think that was a cool ride. That's me coming to work each day. I'm like figuratively jumping out of that plane, sort of thinking, this is a great rush on the way down, but I better pull the chute pretty soon and land. Yeah. So that's my day, So, and it's good.
Okay, so before we close, I'd like to ask Lexie a question. If we have people who are listening who would like to become veterinary technicians, where do they get started?
I think the first step is to start volunteering or getting a job at a veterinary hospital, whether that be small animal, large animal, ambulatory practitioner, anything, just kind of get your foot in the door to get some experience. And then look up online. There's the AVMA, like I mentioned, they have a list of all of their accredited programs, and it goes, they list it by state. So you can go and see, like, I think in Kentucky alone, we have at least 3 that I can think of off the top of my head, 2 that are within 2 hours of Lexington here. So that's kind of how I would start that way. Then another kind of great way, once you're in a program, is to maybe look into joining. We have a professional organization called the American Association of Equine Veterinary Technicians. It's a sister organization to the American Association of Equine Practitioners, which I'm sure you guys both are active members of. And so I'm the vice president of the AAEVT. So we also have student memberships that offer a lot of great resources for students. You don't have to be in an AVMA accredited program. You can just be a member where it's open to anybody at the equine practice that's not a veterinarian, essentially. So anywhere from someone who cleans stalls to answers phones to does what we do every day. We're open for all that. And there's a lot of great educational resources, online classes. We have a whole online certificate program that's just equine focused. So there's a lot of different ways to kind of get some extra education that's kind of alongside of a veterinary technician program.
Okay,
So,
I think that's great advice for people to get started by actually putting their foot in a veterinary hospital, because you might get there and might not love it. You might change your career path, or it might give you an idea of what part of veterinary medicine you want to be a part of. So how long does it take from when somebody begins to the time they become certified?
So again, it depends on the program. There are 2-year programs. A lot of them are through a community college. You can end up getting an associate's degree. There are also programs that are 4-year degrees. So you can get a bachelor's of science in veterinary technology. In some states, there's actually an alternative path to get credentialed as well, where you can get a bachelor's of science in an animal science degree, and then you can have some qualified work experience at the same time. So it really depends. I mean, obviously we're located here in Kentucky, and that's not an option for us here. But
you guys didn't all go the same route. Like there's in-person programs, and there's also some online programs as well, right?
Yep. I think there's several online programs actually in the United States.
And those are both great options.
Yeah, and Monique is a graduate of one of the online programs.
Yes, I went through Penn Foster, which is a pretty well-known online program. It's also supposed to be a 2-year program, but you can do it as quickly or as slowly as you'd like. Really helpful for people who, can't take time off to go to a school. So if you're working full-time, if you have a family, anything of that nature, you can do the schooling while you're doing those things.
Okay. So to Stephanie, Monique, any advice that you'd give to people besides what Lexie gave them?
No, I think that's really good advice. Figure out if you like it first, and then put the time into going to the schooling and getting credentialed.
Okay.
It's kind of the same as when you are thinking, if you're kind of thinking about going to veterinary school, you're going to go shadow your veterinarian. You can start as, I started doing that when I was 10 years old. Went out with my equine veterinarian.
And came to Rood and Riddle too.
Yeah,
That's great.
obviously.
Okay.
I always suggest that the people who are looking to go into vet school, that, while they're waiting to get their applications fulfilled or things, that they also do vet teching. So not necessarily licensed, because they're going to be vets. But, while they're waiting to get into vet school, be a technician, be on the ground and see what it looks like from that end and get the experience while you're waiting. It's just good use of their time.
Yeah, that's superb advice, actually, because if you do the other person's job, you appreciate them more and you learn to treat them better. So that was Stallside for this week. We have had the absolute privilege of being with some of the technicians here at Rood and Riddle that make us veterinarians way better than we should really be. We have Monique and Lexie from the Anesthesia service, and we have Stephanie from surgery. And when you bring your horse to Rood and Riddle, we may be the face of things, but these are definitely the engine room that get us across the line. See you next week.